Rhonda Siegel. I'm the administrator for the Maternal and Child Health section in New Hampshire. And today you are on the Children's Safety Network's webinar on playground safety. I'm reading all of your poll questions, and it looks like a fair amount of us, including myself, got hurt on a playground as a child. And results are still coming up about what safety topics interest us most, but it looks like supervision is winning, followed by age-appropriate design, which is also one of my interests. We're going to, this is me, our funding sponsor is HRSA, and HRSA funds the Children's Safety Network as an injury prevention technical assistance center. I am on the injury prevention, or the CSN's National Advisory Council. Before I introduce our speakers, I'd like to have Kate Sinclair come on, who has a few technical announcements. Kate?
Thanks, Rhonda. So I'm going to switch us off of our polls right now. Thank you for joining so early and being so diligent to open our polls, everyone. So if you can hear me right now, that's because the audio is broadcasting through your computer speakers. The quality of your audio is dependent upon your internet speed. If you're having issues with the audio, you can dial 866-835-7973. And mute your computer speakers. Your microphone will be muted during the entire presentation. Up in our top of our screen, we'll have our file share pods and our evaluation link. So today's slides are available to download, and then also some of our handouts we'll be talking about throughout the webinar are there as well. Use the Q&A pod in the bottom left to ask questions at any time. You'll see a note from me welcoming you there right now. And as a reminder, this session is being recorded, and all of the people who registered will get a recording archive link once it's posted. Thank you so much.
Thank you, Kate. Once again, I'm Rhonda Siegel. I'm the administrator for Maternal and Child Health in the state of New Hampshire, and before that, for many years, I was the Injury Prevention Program Manager, where I heard and read a lot about our speakers. So I'm very excited to introduce them. Eric Kennedy is an Associate Professor of Biomedical Engineering at Bucknell University and serves as the Director of Injury Prevention for the National Program for Playground Safety. Dr. Kennedy's research investigates the human body's tolerance to injury with the intent to make the world around us safer. Eric and his team of research students develop both laboratory and playground field testing procedures, collect and analyze epidemiological data, and perform technical analyses focused on improving the safety and health of children. Our second presenter is Heather Olsen. She is a professor of health, recreation, and leisure services at the University of Northern Iowa and is the executive director of the National Program for Playground Safety, which hopefully all of you have heard about. Dr. Olsen's research collection has focused on playground injury prevention and outdoor play, targeting children's health and well-being. Our third speaker is Jennifer Vanos. She's an assistant professor in the School of Sustainability at Arizona State University, specializing in human, and this is my new favorite word, biometeorology, examining the influence of atmospheric processes on human health, specifically extreme heat, thermal comfort, and heat stress, and the intersections with urban design. Dr. Vanos has a strong focus on understanding children's environments and lessening exposures to support thermal safety. So thank you very much. We are going to start with Dr. Kennedy.
Good afternoon. Thank you. Dr. Siegel, thanks for the introduction and for moderating this section. Also, thanks to the Children's Safety Network for the invitation to deliver this webinar. As Rhonda mentioned, there are three of us today who will be talking about playground safety. She gave nice introductions for everyone, but just to quickly recap, I'm Eric Kennedy. I'm a faculty member in biomedical engineering at Bucknell University. I'm also affiliated with the National Program for Playground Safety. Heather Olsen is a professor in the Department of Health and Recreation at the University of Northern Iowa and also serves as the executive director of the National Program for Playground Safety, the organization which brought the three of us together. Jennifer Vanos is a biometeorologist, again, a favorite word of the day, in the School of Sustainability at Arizona State University. All of us have had the opportunity to present our work and the work of our colleagues and collaborators throughout this presentation today. But before I dive in, I just need to acknowledge I can't imagine beginning without acknowledging the circumstances, the time that we're in. Yesterday was the Memorial Day in the United States, signifying the end of a long weekend that usually sees crowds in recreation areas all across the U.S. However, that was clearly not the case. So I'll give it a second for the image to load. 2020 has brought some completely unprecedented times. On March 27th, 2020, NPPS did something we had never before even had to consider. Our website was updated to reflect the support of our community closures of playgrounds. As of last week, our website has been updated with guidance documents, one for our playground visitors aimed at adults and frequent questions or concerns that they may have as they consider taking children back to playgrounds as communities begin and consider reopening. The other is a document that's available for facilities management teams or decision makers and maintenance personnel who are faced with how to safely reopen playgrounds and what information they need to know and how to communicate to the public. They're both available from the front page of our website and draw largely from CDC and EPA guidance, as well as other information that you'll hear today. We appreciate everyone's time and just want to provide a talk that we feel discusses the important role that playgrounds serve within our communities, parks, and schools, and provide insights into those spaces and how to appropriately allow our children to maximally enjoy and express themselves. I'm going to spend a few minutes this afternoon establishing some context for playgrounds within our community and the often unrealized significance of playground safety. Heather will give a brief context on NPPS and the recent projects that we've been involved in on playground safety. And then Heather, Jenny, and I will briefly discuss a series of topics ranging from behavior, environmental factors, and influences on children, and of course the playground infrastructure itself using NPPS's SAFE framework. And then finally, I just want to mention we completely understand that the information that we're presenting today only allows us to touch briefly on each topic. So I want to share some information at the end of today's presentation on where you can go to find out more information. I think it goes without saying that children are important to us. NPPS has spent the last 25 years studying and thinking about playgrounds at schools, in child care programs, and in our communities. We believe it's pretty simple to understand that playgrounds are a central hub for child play, fun for families, and spaces for vibrant cities. We understand that urban spaces continue to expand, that green spaces are a major area for people to congregate. If we look at this picture here in this one community, we ask that you imagine the number of young children living in that space and the parents and the grandparents with children that often make playgrounds a destination that are used on evenings and weekends and throughout the day. We understand that playgrounds are a major investment from the startup cost to managing and maintaining the space, and so we really want these play areas to be used effectively. I don't want to go long or deep into statistics, but I do want to elaborate on just a few key points. The first I always mention because I think it's dramatically underappreciated, that playgrounds are the leading location of recreationally induced injuries to children from ages 1 to 10. Not bicycles, not various sports, trampolines, et cetera, it's playgrounds. Different studies promote slightly different numbers, but overall we are talking about 185,000 to 200,000 emergency room-bound injuries per year in the United States. In fact, playground injuries have been relatively stagnant for the past 15 years for any number of reasons: stagnation within standards, an increased density in playground utilization, and in some cases increased vigilance for injuries such as traumatic brain injuries, which has actually shown a slight rise to over 20,000 playground-related TBIs per year. The next slide is intentionally a doozy, so forgive me, I know it's a complicated slide. It's meant to convey the complexity of playground safety and child well-being. On the left, if you can imagine, is an iceberg. It's meant to represent that there's a lot often hidden below the waterline. Above the blue dashed waterline are the things that are readily and typically measured and available when considering playground risks and benefits. I just mentioned on the previous slide playground injuries, which are approaching 200,000 per year, but that number alone is very misleading. That is 200,000 emergency room visits per year, which does not include, as many of our audience knows, the minor and moderate injuries that are sustained and treated by a school nurse, a pediatrician, urgent care facility, a parent, other caregiver, etc. There are so many other factors that fall below the waterline that I want to mention and hopefully we'll elaborate on today. We might talk about the 200,000 playground injuries because they're easily and directly associatable with playgrounds, but we want to touch on the environmental factors that lead to adult cancer, the relationship between access to play and childhood obesity, and other areas of complexity within playgrounds. So I think, with that, I think I'll hand it over to Heather and allow her a chance to elaborate a little bit on MPPS.
Thank you, Dr. Kennedy. Hello, everyone. Again, my name is Heather Olsen, and I just wanted, for those of you who are not familiar with the National Program for Playground Safety, we are located at the University of Northern Iowa. We were established in 1995 with a grant from the Centers for Disease Control and Injury Prevention. And from 1995 to 2005, our mission and charge was to raise awareness of playground safety. And fortunately, through time since 2005, we have been conducting small research projects and continuing to disseminate information. We know today's audience is very diverse, with a number of you have different backgrounds, and some of you you're on playgrounds every single day, and others of you may not be on a playground every day. But one of the important things that we thought we wanted to share with all of you is that there are agencies who are taking a lead in playgrounds and playground safeties. First, the Americans with Disabilities Act has now adopted regulations for accessible playgrounds and playground routes. And to learn more about playground accessibility, I would encourage you to go to the ADA website to learn more. Second, the ASTM International, they have several different technical specifications to enhance children's safety for playground manufacturers, both for the equipment and for the surfacing. And interesting, the Public Use Playground Equipment Committee is one of the largest in ASTM, and we meet about twice a year at various locations. Third, the Standards Council of Canada also has technical specifications for playground manufacturers, and it has just recently, in the past month, have gone through revisions the past year, and it's recently been released. And the last agency that we want to highlight is the Consumer Product Safety Commission, also known as CPSC. And CPSC has provided safe information for the public playground equipment in the form of guidelines, which you can see here on the left, the purple handbook. It's called Public Playground Safety Handbook. It's available on their website. It's a free download, and it has a wealth of information for maintaining playgrounds, to designing and laying out children's play areas, to surfacing. And an important note for all of you, I'm not sure where everyone is represented, but I'm guessing with the large crowd that we have today, many of the states are represented. And an important note for you is that some states and local jurisdictions have used the CPSC handbook to require compliance according to that handbook. So this, or even at some states to comply with ASTM voluntary standards. So I would encourage you to get in, to be aware of what's happening at the local level within your state. We recently led a project for the Consumer Product Safety Commission to conduct playground field testing, and the study included us, the National Program for Playground Safety, creating a playground checklist, an impact attenuation. Am I still there? a playground impact attenuation playground surfacing data collection sheet, and we sampled 103 playgrounds across the United States. To learn more about this study, a report is available on the CPSC website, which will show you these resources, these checklists, and then it'll provide you with some up-to-date descriptive information about the safety of playgrounds. We have also recently had an opportunity to conduct a research study on thermal comfort in playgrounds for the Standards Council of Canada and Public Health Canada. And this research that we did for them led to an informational annex that is put in their 6th edition of the standards that was just released in March of 2020. So when the technical report comes out, I'll have a robust list of resources and tools for you all to get, and the literature review provides a guide for ideas at the local level. We were told just last week that it will be available in English and French, and the technical report will be released in the coming weeks. So we share our recent work with you because these projects have been so valuable for us as academics, and then also valuable for us serving with the National Program for Playground Safety. We have learned a great deal from being in the field, collecting data, and listening to playground users. The data has been meaningful, and it has guided us in new ways of thinking and sharing up-to-date information with you. As we are supported by, our charge is to support information that's data-driven to improve safe child play. And our charge is to gather data from playgrounds in the field, talking with playground owners and managers, and to visit with playground users at the local, state, and national level so we all can work together to improve safe child play. Without the continued support of so many agencies that I've highlighted here, NPPS wouldn't be here today sharing what we are learning from the field and in our research and what we know today about playground safety. Now we turn the attention to a question that I've been thinking about. What are we talking about when we say playground safety, and what do we've learned from recent research? And I could bet if I would have an opportunity to sit with all of you and ask 20 people, or all of you, why children get injured on the playground, we may very well get 20 different answers, or we all may give different answers. Many of you from the opening survey have been injured on a playground. Even if it was 30 years ago, I bet you can probably remember the exact details, what you were wearing, where you were playing on, possibly who helped you. Each of these stories is heartbreaking, and when they are told, they provide no guidance or exact steps for how to change or to stop that injury from happening. For all of us here that are interested in making that environment safe and healthy for children, one of the things that the National Program for Playground Safety did in the original funding was to create a framework or a conceptual model. And this model here that I'm showing helps us visualize the play environment and possible risk factors that happen that are associated with a child injury. Thanks to the Centers for Disease Control and Prevention in 1995 and charging us to raise awareness about this. One of our first tasks was to figure out what is our messaging. And the Safe Playground Framework was developed and presented in the National Action Plan for the Prevention of Playground Injuries. In fact, it was released at a press conference in Washington, D.C. And then since then, it has been a blueprint for the creation of safe play. In this slide, we have identified these 4 risk factors: S, supervision; A, appropriate environments; F, fall surfacing; and E, equipment maintenance. And rather than them being hierarchical in nature, these 4 risk factors and elements interact with each other. In order to create a safe environment and a healthy environment for children to play, we need to think about all 4 of these. To learn more about the SAFE framework, I would encourage you, if you have never visited our website, we have, when I say new, meaning the last year, we have updated our website. And if you go to the topics page in the SAFE resources, there is a wealth of knowledge and information that we have put on our website for all of you to be able to take back to the local level. So I'd encourage you to take a look at the website. The first risk factor that we want to talk about is supervision. Supervision is essential to the playground safety equation because it saves lives, it prevents injury, and it avoids litigation. Supervision, though, is sometimes one of the most overlooked components because it can be assumed every adult knows how to supervise. But supervision is more than just watching children. Supervisors aren't there to direct play or control play, but they're there to support the child's play. They're there to anticipate potential hazards and to save a life. And research has shown that with proper training and staff consistencies, injuries can be reduced. So what is NPPS doing to talk about supervision and to educate and disseminate about supervision? We advocate for the ABCs of supervision and to anticipate hazards, behaviors, having positive and safe behaviors, and having considerations, developing supervision plans, maintaining appropriate staff-student ratios, teaching the basics for reporting injuries, and preparing for emergency situations. To learn more about playground supervision, one of the things that I would highlight is our new playground supervision kit. And to learn more, you can find it on the website. There's a video trailer there as well. Thank you for your time and thinking about the topic of supervision. The next conversation we're going to have is on appropriate environment. So I'll turn it over to my colleague.
Thank you, Heather and Eric. Those were great overviews. So I am tasked with talking about appropriate environments, and there's various aspects of ways that the NPPS thinks about appropriate environments, whether it's about inclusive spaces or child development characteristics or nature-based outdoor environments. But my focus for the next few slides will be on how we can offer suitable environmental conditions to make sure that environments are really appropriate for children to use the spaces to the best of their ability. So I'm sure many people on this call understand there's a large benefit to play for children, and that children gain a lot of physical activity and play periods over the course of their lives. It can be up to 700 in play periods per year, and that's a lot higher when you think about playground usage on weekends and after school. So it's so vital that it's included in the UN Conventions of Rights for a Child. But that means that any concerns that could potentially hinder a child's ability to play, and of course I'm focusing on the environment here, so unsafe environmental conditions, polluted air, persistent heat and sunlight or chemicals, that can hinder the child's ability to play and is really important to consider. And an important aspect of these environmental factors are that they're often invisible to us and to our eye. And so when I think about how to design play spaces that are more thermally conducive and environmentally safe, that's my goal. So how can we do that in a way that makes play and being active more conducive for children for a longer period of time throughout the entire year? And as we go into our summer, I think it's really important to think about this and how the design of play spaces can either support or hinder a child's ability to use that given environment. And so Heather mentioned a couple times thermal comfort. I mentioned thermal comfort, and I'm going to be talking a lot about heat and radiation exposure. So I wanted to talk about how these are part of the place-based design and how we think about this from a child's perspective. So if you have a child playing on a playground, there's all of these different environmental factors that we can't see that are impacting how a child feels and their ability to be safely active, especially in the heat. And what's really important to notice and to stay aware of is when there's an overexposure to sunlight, because that's what relates to heating the surfaces and UV exposure on the skin. Of course, when children are playing too, they have a higher metabolic heat load, and that's going to increase their potential risk for heat illness. So it's really important to be aware of that and know that water is available and that they know when to stop or are guided when to stop if they're getting a little too warm. The other important factor is that in a very humid environment, so people in the southeast and on the eastern side of the country will experience more humid environments, and that decreases the ability to evaporate sweat. But then if you're on the dry side of the country and we're reaching temperatures this week in Phoenix, we're going to reach about 109, 110 Fahrenheit. That means that we're going to have issues with losing heat through convection. And so I consider all of these pathways when I think about how to design an environment in a given city, in a given climate zone, so that it can be conducive for children's play, even during the summertime, because they do want to get outside and play. And so this is the framework we used when we did work with the Standards Council of Canada and Health Canada on how we can design thermally appropriate environments for children across various climate zones. So these types of environmental dangers haven't really gotten as much attention in the past, but they're equally important in making sure that spaces are conducive for children's play. So I'll be going through UV exposure and sunburns, high surface temperatures, and hyperthermia and heat illness, and how one by one, and how each of these can affect play. And so we know that sunburns and UV exposure can be linked to adult cancers and melanoma, and that high surface temperatures in contemporary playgrounds, like you see here on the right, can reach very high surface temperatures. And these are in degrees Celsius here, but the 71 degrees Celsius is equal to 160 degrees Fahrenheit, and then 80 degrees Celsius is equal to 176 degrees Fahrenheit. And so I'll get into this more later, but these are temperatures that can burn a child's skin, and that's important to acknowledge and be aware of. And then just how being in conditions that could lead to heat illness can result in other factors affecting a child's health. But it's really important to understand that illness or effects of these exposures are completely avoidable, and they are all interrelated. And finally, what I'll say is, as we go into summer and we think about climate change, I want everyone to understand that these are not problems that we're going to be dealing with in the future. These are problems we deal with today. So I call them today problems, and there's a lot that we can do in terms of how we think about design and shade and surface types, and utilizing various aspects of building appropriate and safe environments that we can use today that will also mitigate heat exposures in the future as a form of adaptation. So with shade and UVA radiation and health, this is really important to understand from a school perspective and a community playground perspective. And we did a survey with the Arizona Department of Public Health last year and found that less than half of school districts have shaded play spaces in their schools, which is really important, and a lot of them really wish they had more shaded spaces across the state of Arizona, and which is the sunniest state we have in the U.S. And then a study that Drs. Olsen, Kennedy, and I published last year also found that less than 67% of play spaces have shade over them in the midday across the country. Now, looking at how this affects surface temperatures is really important, so that's why I say what is above the surfaces really matters. If you have an unshaded surface that is all rubber, like I show here in this infrared image, it's going to reach temperatures, again, that can cause burning to the skin. So this rubber surface, so 76 Celsius is 172 Fahrenheit, and that was a playground in San Diego. And it's important to acknowledge that within our urban heat island, we have these temperatures that can be the highest in playgrounds. And so I think we need to rethink how we're designing or thinking about playgrounds so that they aren't the hottest spaces in an already hot urban area, and that we can be incorporating more vegetation and water and shade to ensure that there are more cooler areas that people can seek out and ensure that they don't have to worry about children getting sunburns or burning their hands. And so getting into thermal burns and the thresholds, so I've mentioned all of these different temperatures of these surfaces, but part of a study I did here with ASU in 2016, we looked at what does that temperature truly mean? And so a lot of these surfaces I've been showing you that reach 80 Celsius or 71 Celsius can burn a child's hands or feet in less than 3 seconds. And being inexperienced, and children like to throw off their shoes and they won't have the response time that an adult would have either, it can result in thermal burns and second-degree burns to the feet. These aren't that well reported either, but I want to kind of point out that on this picture of the slide on the left, bottom left, you can see that in the shade, the slide is much, much cooler, down to closer to air temperature. And so that play space, while it's safe to play in under the shade sail of that play space, it's really unsafe to play in if they were to go down the whole way of that slide and potentially burn themselves. So the MPPS put in handheld infrared thermometers into their supervision kits, which has been really great, so that playground inspectors and supervisors can start to measure with these low-cost instruments that you see here on the right-hand side, the surface temperatures of these different playground materials. So getting into more extreme heat and health and heat illness, the same report or same survey that we did with Arizona Department of Public Health Services, we also asked nurses what they thought and administrators what they thought about heat being a public health concern. And nurses always responded that heat was a public health issue at schools. And when we think about what the effects of heat might be, it's important to put it in this pyramid. We use this a lot in public health, where we want to know what is the proportion of people affected and the severity of impact. So if you go to the bottom of the pyramid, you have more people impacted by things like physiological changes and subclinical effects or symptoms and illness and medication use, and then you have a lot less people affected by the top of the pyramid, which gets into death, which is good. But we also often don't know what's going on at the bottom of the pyramid in schools or playgrounds. So who's experiencing heat cramps, heat exhaustion, heat stroke, which kids might be missing class, how is their mood, behavior, cognitive ability, and engagement in class changing? And are kids even able to be physically active in some of these environments? A lot of this information we don't know too much, and so it's a bit missing in terms of what we know and what data we hope to collect more of, because we want to not allow it to get to a point where kids do have to go to the emergency department for any of these issues, which commonly occurs in the summertime from playground exposures and sunburns. So I wanted to point out some really great collaborative messaging and work that I've been able to do with the National Program for Playground Safety. So a couple summers ago, Good Morning America got really interested in understanding the dangers of hot playgrounds, and that was a really great way to message in the middle of the summer how hot these surfaces can get and what we can do about it. And then the National Program for Playground Safety also incorporated a lot of this new information and safety concerns related to heat, radiation, exposure, and burns into their messaging. So you can go on their website and find more information about which surfaces might be the leading culprits, which are slides, artificial turf, and rubber surfaces, and what you can do about it and how you can think about utilizing shade to the best of your ability in these play spaces and thinking about future design. Another important factor I wanted to mention is just when you think about those hot surfaces, a child's core and the core of their body is a lot closer to those hot surfaces that are radiating heat from them, and so that can increase their risk of heat illness. So I wanted to give a quick example of a project we're doing in South Phoenix and just tell you a story, and I apologize this slide didn't turn out as we had planned. So we're doing work and we're redesigning a play space in South Phoenix to try and mitigate exposures to heat and air pollution and UV radiation. And we're working collaboratively with this Title I charter school in South Phoenix through various funding mechanisms. And we're not only focused on heat, but rainwater, and ensuring that the way it's designed can also be used as a play environment. And part of this was getting community input and having the kids tell us, what do you want to see in your playgrounds? What do you like in your playgrounds right now, and what do you want to see in the future? And so this is just an example of how we can be more socially embedded and get community input in the playgrounds. What I've been doing for the last year is getting very hyper-local fine-scale measurements of the environment from radiation and heat and humidity, and being able to share a lot of that environmental information with the teachers to use in classes that's available to them, as well as air quality information that they can use. So we're making sure we're creating accessible data that they can use to their benefit to understand the thermal aspects of their environment. And so overall, the charge in my collaborations and work with the MPPS is to make sure that environmental conditions get some further attention in playgrounds, and make sure that we get a more holistic view of playground design, both short and long term, as we move forward to achieve comfortable and safe play spaces so kids can remain being active. So with that, I will turn it over to Dr. Kennedy, I believe.
Thank you, Dr. Vanos. This is, I think, that section just elaborated on what I mean when I say that there's a lot below the waterline that we often don't consider when we think about playgrounds. So I hope that people found that really enlightening. I'm going to take a couple minutes here to talk about the next risk factor, which is F in our SAFE framework, or fall surfacing. I already mentioned the 200,000 injuries that show up in the United States emergency departments every year as a result of playground injuries. And I think as often as readily apparent, fall surfacing is a very obvious nod to the intent to reduce playground injuries. Just some basic statistics. For injuries resulting in emergency room visits, falls account for approximately 3/4 of all injuries. Fractures of upper limbs account for about half of all medically treated injuries, and 88% of those, half of all medical injuries, are injuries, upper extremity injuries attributed to falls. Finally, an important finding from a recent study showed that there is about 21,000 children treated in emergency room departments for traumatic brain injuries. And no, I'm not going to acknowledge, though I want to acknowledge that these are not all due to falls. This is an important discussion point when I talk about playground surfacing, as I think I'll explain in a subsequent slide. Many playgrounds, particularly at home, have equipment placed directly on grass or dirt surfaces. And so one thing we just want to acknowledge or mention is that installation over a hard surface, such as asphalt, concrete, or packed earth, grass, can result in serious injury or death from falls. As a quick reference, any element of the playground where a child is elevated to interact with the equipment then therefore requires appropriate surfacing. So in other words, unless the children are playing while standing on the ground, it needs some appropriate surfacing. The purpose of this playground surfacing is to absorb the impact from a fall, spread the impact out over a longer period of time, which results in lowering the peak forces and ideally leading to lowered injury risk. And so as someone were to go through the model and make a decision on appropriate surfacing, MPPS has available a safe surfacing decision-making model to help inspectors determine the safety of the surface. I like to suggest that if you're looking at this slide, we work from the bottom up. So we start with no surfacing, and we work our way through to achieve safe fall protection. So the first step is compliant surfacing materials. What type of material are you going to use? A loose fill material or unitary surfacing. The second step, determine the coverage for use zone. So where does the surfacing need to be? What is the use zone for a slide versus a swing, and where does that surfacing need to be placed? The third is to determine, based on the fall height, what the thickness of the material needs to be. So how high of a fall do we need to protect against? And then finally, after installation, consider the surface maintenance. How often does the surface need to be maintained? What are the common issues or hazards with different types of play surfaces? And how might those be affected at that specific installation? For example, a school that might be maintained every day versus a playground and a picnic area at a park that's more secluded. Our goal is to develop a plan that allows you to work through each of those decisions to maintain an appropriate surface for the visitors. So There are a lot of different types of appropriate playground surfacing materials, each with their own advantages and disadvantages. I don't want to paint with too broad a brush, but let me describe in two primary categories. At the top, you see a number of different type of loose fill surfaces, both natural or synthetic materials that are, as they are described, a loose installation of the surfacing, meaning that it can be dispersed and kicked around, et cetera. The second is unitary surfacing. Most often those are synthetic, but occasionally some natural materials that are installed with a binding agent that provides a continuous surface around the material and limits the amount of displacement that can happen. Both types of surfaces are tested against the same impact attenuation requirements. So in a general sense, the decision falls to then cost or maintenance, their plans, the site plans that you have, the location, and then as Jenny mentioned previously too, the surfacing is interrelated with things like environmental integration, heat retention of materials, color selection, et cetera, influenced by the presence of shade. We also have to factor in installation and maintenance costs, accessibility and access, and then, as I mentioned, the other factors, which I'll talk on in a second, the equipment height and utilization zones of the material. So first, the coverage zones. As I mentioned this before, but the playground surfacing is meant to absorb impact from a fall, which basically spreads the impact out over a longer period of time, which lowers the impact forces and then leads to a decreased or lowered injury risk. Different pieces of equipment on a playground often result in different use zones. So you can work with the equipment manufacturers, surfacing companies, as well as designers to identify the appropriate amount of use zone, or sometimes I would consider it a runoff area around different pieces of equipment where the surfacing needs to be placed. Often you'll find if you visit a playground that the largest possible use zone is then there's just a line that's drawn around equipment, but that there are places or instances where that surfacing utilization can be optimized. I don't have a picture of it on this particular slide, but there could be a transition, for example, from an impact attenuating surface to some other type of surface before, for example, a large sandbox. So you don't necessarily need to run attenuating surfacing all the way up to a sandbox if it's at ground level. And so there are lots of ways to perhaps optimize the installation of surfacing. For evaluating the fall height and the thickness of the material, this is not something often that I think many of the people in our audience would necessarily be doing, but I think it's important to understand. And so surfacing is predominantly considered and evaluated by a standard known as ASTM F1292 in the US. It's aimed at preventing a serious head injury. So remember before I mentioned that we see approximately about 20,000 cases of traumatic brain injury to specifically from playground injuries in the US per year. This standard is designed to help prevent serious head injury. The testing methodology does not necessarily cover all injury modalities. That is, that's not what the standard was developed for or how it's been curated. There is a thought that the head safe evaluation of a surfacing would therefore mean body safe, but we also know that upper extremity injuries, for example, far outnumber the cases of serious head injury, and this can be thought of both ways, that the standard might be preventing serious head injuries, but also you could interpret that the standard hasn't been validated for fracture prevention. There are two metrics that are used for this vertical drop. The first is maximum Gs and a metric that's a calculated number called HIC, or head injury criterion. I just want to point out that this can be thought of as a pass-fail requirement, which is true. You either meet the standard or you don't meet the standard, but it is acceptable and relatively common for owners to establish a goal of exceeding the standard. For example, the surfacing that would meet 150 Gs or in 700 HIC, et cetera. Individuals can set their own limits for where they want their surfacing to fall. The surfacing is evaluated in a range of temperatures and derived to match the performance of surfacing with the fall height of the equipment, meaning what is the maximum height of a particular piece of equipment that a child could fall, and evaluating for the effectiveness of the surfacing and attenuating that. The standard is derived as part of a laboratory field test, but MPPS believes that field testing, I'm sorry, let me repeat that. The standard is derived as part of a laboratory test, but we feel that field testing is equally important to assure your performance at the site of the playground and allow you to identify maintenance issues or other installation issues. Just real quick, a couple items that I think lead into what Heather's then going to talk about, but in terms of surface maintenance. Maintenance of the materials is critical to the performance. The picture on the left shows grass roots, and the root bulbs can affect the performance of the loose fill surfacing. Moisture present is obviously in gross scale here on the right, leads to decomposition, settling, and erosion of the natural materials. Similarly, we see patchwork fixes that need to be implemented for unitary surfaces. This is a pretty common issue that you'll find that surfaces are worn or in most worn exactly where you need the protective benefit of the surfacing because of the high traffic as well as the high impact nature of that location. And then the final thing that I'll talk on before I hand it over to Heather is wear mats. You'll see actually in this picture there's rubber pads installed under some of the swings in this area. MPPS is familiar with the frequent utilization of these rubber mats over loose fill surfacing to help prevent erosion at high use areas such as slide outlets or under swings. And we just want to point out that those mats need to be tested for the same impact attenuation performance as well as the surrounding surface. It is not uncommon to actually see rubber mats installed on top of surfacing that negatively affects the impact attenuation of the surface. So with that, I'll hand it back to Heather for equipment maintenance.
Wow, there has been so much good information shared with you all, and I hope that what we're disseminating is not coming out too fast for you all and that you can stay with us. But please know that a lot of the content, or actually most of the content that we have shared with you today is available on our website. You're going to be able to access it in the reports that we share with you. But really quickly, I want to highlight equipment maintenance. And because we all know playgrounds are a major investment for communities. They're expensive, but they're livable. They make communities livable and are healthy places for children to go. And we believe the playground is similar to a new or pre-owned vehicle, right? You have to maintain it. And thinking about this, you are the mechanic of that play environment, whether you're a parent visiting or you're an owner-operator or you're a licensing consultant and you're inspecting it. But we have got to make sure that we take care of these play environments. And one of the most important things is to have a maintenance program, to be proactive and to respond to needs before any injury or a crisis occurs. Our aim for the National Program for Playground Safety is to help you prevent unsafe equipment hazards, keep equipment operational, and eliminate the costly repairs. And that's by doing checks and keeping an eye on it. Now, a comprehensive maintenance program is more than just keeping an eye and making sure the equipment works. It also involves everything in the play environment that contributes to the overall well-being and the environmental hazards of the area. So we need to think about fields and shelters and shades and sidewalks and containment barriers, where the children have access to play. How do we think about safety in a very broad, holistic view to help the child have a safe play environment? Again, I want to highlight, I highlighted this earlier, but the Consumer Product Safety Commission, this handbook it's informative, it has great information in it, and I would encourage you all, if you don't have this, go get this, it's a free download. Also, the National Program for Playground Safety has very simple checks, and we have different manuals, and we have teaching, online teaching instructions that you can get more information about how to maintain or what to look for. Good maintenance means ability to identify the problem or the potential problems, then understand the reporting procedures or the repair processes. And our charge as our colleagues and with working with my Eric and Jenny here, we want to start thinking about new ways of playground safety, including the importance of cleaning the environment. how to reduce child arm fractures, excluding pesticide use at children's play spaces, and reducing UV exposures. And really our aim is to create healthy environments that protect children and families and that they can play for longer periods of time. So briefly, we have 4 tips for you. Number 1, clean and sanitize. This may seem really obvious right now as we're faced with the global pandemic, but as communities, and I just read on the little Iowa today, the governor has reopened playgrounds in the state of June 1. As communities are beginning to lift restrictions on playgrounds, all of us need to work together to figure out a safe and affordable way to clean and sanitize these play areas. And I'm a mom of 4, and I know, we now have hand sanitizer in our car, and we have trash bags in our car, and we do those daily things because, and I hope we all can educate parents in that same way. So remember, we have, the other thing I wanted to share with you that Dr. Kennedy opened in the beginning of the presentation, we have really nice handouts on our website that can help you start thinking about what to do at the local level. Number 2, something very simple, check for strangulations. When I visit playgrounds, I am amazed at the number of loose ropes, jump ropes that are on playgrounds, head entrapments. Strangulations and head entrapments can be life-threatening, and unfortunately, too many children have died because of strangulations. So we need to watch for these things. S-hooks, another concern with equipment that over time, those S-hooks should be completely closed, so a dime cannot pass through, and you can close those with an S-hook pliers. So just simple little things that we can all do together, working together to keep environments safe. Remove all loose ropes and jump ropes from the playground. If you're running by or out for a walk and you see a dangling rope, take time to go get those removed. The third, pay close attention to sharp points and crush and shearing points. Just like your car, you have to put oil in it. You have to maintain it. Sharp points wear, and they can appear, but having a maintenance plan, you can prevent those from happening. Look for any moving parts on equipment, moving parts, loose parts, riding toys. I know there's a bunch of people in early childhood here, and we have our tricycles and riding bikes. Those should be checked as well. They're part of the environment, and looking for where shearing and crush points can occur and preventing those from happening. Lastly, aging playgrounds demonstrate more maintenance. It's just like a car. If you drive an older car, it's going to have more maintenance that happen. So playgrounds do require maintenance once you put them up, but they're not going to maintain forever. So it takes a champion of people, whether they're the community members, the owner-operators, to really work together to take pride in that environment. So it's very important to have a maintenance plan. And what does that plan look like? Depends at the local level, depends on the type of environment that's there. So if you want to learn more about maintenance, we encourage you to look at our website, and I am going to turn it back to my colleague to talk about some great resources that we want to drive you to be able to take with you when you leave after today's webinar.
Okay, so I get the pleasure of wrapping up real briefly, and one of the things we mentioned at the beginning is that we wanted to let everyone know where some resources were from our website. We mentioned the Consumer Product Safety Commission's website, so let me just briefly walk through a few of those things. So the first I wanted to mention was the CPSC handbook, as well as our recent report on the current status of playgrounds, which is our national sampling of 103 public playgrounds that Heather mentioned, are both publicly available and free. They can be found by visiting the CPSC website or by visiting MPPS's website, and they're directly linked off of them. If you go to CPSC's website, you'll notice, if I could get the pointer to work here, you can go from the main page, you click on the menu here, go to technical reports. From that technical report page, you'll actually see a section on playgrounds. And so you can actually see where to download our report from the national study, as well as other previous reports on playground safety. The second thing that I wanted to mention was the much related to much of what Jenny spoke about. We wanted to make sure you're aware, excuse me, let me get my pointer off there. We wanted to make sure you're aware of the availability of a free technical report that, as Heather and Jenny, I think, both mentioned, is soon to be released on the SCC website. So we can't provide a direct link yet, as it's not yet posted, but our report on thermally comfortable playgrounds will be listed under SCC's publications as a free PDF. It's about a 60-page report on considerations for the development of thermally comfortable playgrounds. The appendix of that report includes an annex which is useful as a summary guidance document for both new and installed playgrounds. And then similarly, in addition to the publicly facing document, I wanted to mention that the informational annex that is available to the public as part of our collaborative report on thermally comfortable playgrounds is also included in the Canadian Standard for Children's Play Spaces and Equipment. And I mentioned that although it's not freely available, the standard is available for purchase. We just wanted to point out that this is thermal comfort and practices that can improve the playability of a playground or play space for a child are included along with the design standards for play spaces in Canada, and we hope to follow in similar format by other standards organizations and groups as well. Finally, as I wrap up, I'd be remiss if we didn't point you directly to the MPPS website for more information. We're proud of a new website launched in January 2019 for all the resources and information that we summarize on the site. One of the things that you'll notice is a topics page where you can visit 16 different tabs for information, much of which we shared today as part of our SAFE framework, and including a page on COVID-19 and the return to play and playgrounds. Let's see. Similarly, we offer training to local groups or statewide agencies. If that's of interest, please check out the training tab for various offerings and certifications that are available. And then as I wrap here, we have several individuals who are assisting at the local level, and so you can find on our Take Action page some downloads, including some of the downloads that are provided as PDFs for attending this webinar. I'm not going to go through all the rest of the pages on our website, but I encourage everyone to take a look around and see what reminders you have about the content that we discussed today, and for links to more detailed reports for information to allow you to dive even deeper. So before I take any questions, I just want to thank many of the people who have helped us day to day in support of our mission. We hope you found the webinar useful and enlightening, and we'll be glad to help with any questions you guys might have.
Thank you very much, Eric. That was wonderful. We're going to take some questions. There are several questions on cleaning of equipment, and I am going to refer you to the website. I also, there's a question, what is the best way to impress upon staff monitoring recess about safety concerns?
This is Heather, and I'll take this one. And my experience is bringing the team together and having a conversation and allowing the group of whoever is supervising at different times, having them setting staff time to really talk through the struggles and or else ideas, and the consistency is so important. I know when training happens, it brings people together and it allows for that. But, you know, oftentimes we're so busy with so many other curriculum issues and other issues that have to be addressed. And the playground is usually on the last of that to do a meeting agenda list. So I can't advocate enough and it doesn't have to be long, and it doesn't have to be a long agenda, right? It just needs to get people on the same page talking to one another and setting it up. And I'm very proud of our supervision kit that we just launched. I think it's 10, 11 months now, and it has received great reviews. The videos are fresh, they're informative, it guides you through that. So I'll be done because I could keep on talking, but I'll let the next question go.
Okay, and we have another question. It says, great information, but do you have specific information for like my playground at home, for home playgrounds?
Yeah, this is Heather too, and I'll take this one. And our charge and our mission, you know, when we were started in 1995, our organization was to raise awareness about public playgrounds. So we really focused on childcare, early childcare, schools, and community parks. I do want to give you a resource. The Consumer Product Safety Commission also has a home playground handbook, and I'm going to refer you all to also download that. And some state child care licensing groups have adopted that, depending on what state you're in. So please be aware that the Consumer Product Safety Commission and maybe CSN can also get that home one posted on the chat room as well. I know if you haven't, I believe they posted the public handbook one, and I'm sure they would be willing to post the home one as well. Thank you for the great questions.
Okay, I think we have time for one more question. Can child care teachers receive training on supervision on children during the playground times?
I think this one will be me again. The question was, can you repeat the question just so I have...
Can child care teachers receive training, supervision training on children, how to supervise children during the playground times?
Yes, the National Program for Playground Safety does recommend that child care teachers, paras, teaching assistants have training for young children.
Great. Thank you. All right. There's one more question, I think, on splinters, which my children have gotten on a playground. Can we end with this?
Is the question, do children get splinters? Yes, they do. And, you know, splinters it's a very common, right? And I will go back to say that it's so important that the maintenance happen, right? And it's not just a maintenance once a year, but we have a thoughtful, and when we say check the playground, there's a difference between walking around the playground and just taking a glance over it, or fully, I always, when I take my college students out, right, one of the classes I teach, we have a little section on playgrounds, and I make them go out and I make them physically touch the playground. And we look at those splinters, but doing a quick scan, but those splinters with wood, and it's very important to think about the product you're going to, who's your user and the type of product that meets that user's needs. So there's two things here, purchasing and maintenance. I hope I could go on about splinters for another half hour, but I'm getting the please wrap up sign. So another very good question, but I do think with good maintenance practices, you can prevent those splinters.
I want to thank you very much, both the presenters and all of the participants. Thank you very much for coming to this Children's Safety Network webinar.